From the St. Louis Public Radio Newsroom, this is The Gateway. It's Tuesday, January 7th. I'm Abby Larico. Male athletes are usually the focus of concussions, but new research shows that concussions for female athletes have tripled in the last 20 years, and scientists want to know why.
The girls maybe are more upfront with their symptoms and coming to their parents or coaches or doctors and saying that they might have had a head injury and want to get checked out.
More on gender disparities in concussion research. That's coming up after this news on The Gateway. Crews are back out this morning, continuing the work of clearing the layers of sleet and snow from area roads. The Missouri Department of Transportation reported dozens of stalled vehicles Monday on highways in the metro. Local street conditions continue to be a mixed bag, with even some main thoroughfares still icy. Emergency responders are urging anyone who has to drive today to navigate carefully and keep leaving extra time and space between other vehicles on the road. Metro Bus is set to run from 8 a.m. to 8 p.m. today with limited service on select routes. Metrolink trains are running as usual. Call-a-ride service resumes today for essential trips only. More than 200 flights in and out of Lambert St. Louis International Airport were canceled Monday. Check with airlines to confirm any changes to travel plans. Many offices are staying closed and local school districts are once again canceling classes. Some, including St. Louis Public Schools, will shift to a virtual learning day. There are 3 new warming centers open across the city of St. Louis after St. Louis public libraries were closed Monday. The libraries are expected to reopen today. This is in addition to the 5 senior centers also offering a warm space for people experiencing homelessness in the city. Ryan Sheehan is a spokesperson for the city's Department of Human Services. He says residents should call 211 to find the closest warming shelter.
At a time like this, we have to keep being compassionate for our neighbors, is really what it comes down to.
Local volunteer groups, such as Winter Outreach, have been driving around looking for anyone without a safe place to stay to take them to local shelters. The weekend storm was one for the books, but as St. Louis Public Radio's Kate Grumke reports, maybe not in the way you expect.
St. Louis didn't break any records as far as inches of snow, but the region did get a record-breaking amount of precipitation on Sunday. That's the amount of water that fell if we melted all the snow, sleet, and freezing rain together. National Weather Service meteorologist Marshall Failer says the sleet also compacted the snow down.
There's a greater amount of sleet that fell, and so that really lowers your snowfall totals.
Failer says the official snow total for the multi-day storm at Lambert International Airport was 8.5 inches. The record for a single January 5th of snowfall is 10.5 inches in 2014. I'm Kate Grumke, St. Louis Public Radio.
And this weekend's snowstorm left many in the area fighting piles of snow and sleet with shovels and scrapers. Asia Jackson cleaned off her car outside of her Tower Grove South apartment, but was looking forward to an otherwise quiet day.
Catch up on some reading, and probably binge watch some TV, make some soup, maybe just go outside just to get some air, just to see what's the neighborhood doing.
Well, that sounds like a pretty good day. Temperatures are expected to stay below freezing all week, with a slight chance of light snow returning on Friday. In non-weather-related news, the Rolla City Council is rejecting becoming a test case for an anti-abortion ordinance, at least for now. St. Louis Public Radio's Jonathan Ahl reports.
Abortion opponents based in Texas want Rolla to be the first city in Missouri to pass an ordinance declaring itself a sanctuary city for the unborn. The ordinance would make it easier for people to sue medical abortion providers in cases where it's illegal to mail the medication. Mayor Lou Magditz says he doesn't want Rolla to be a test case.
And nobody else in the state has done this. So what does that tell me? It tells me we're about to be used.
Magditz says the exact application of Missouri's Amendment 3, which legalizes abortion, needs to be settled at the state level. While the council turned back the ordinance last night, it could return in a new form in a month. In Rolla, I'm Jonathan Ahl, St. Louis Public Radio.
Missouri voters passed an amendment in November legalizing sports gambling in the state, but they won't be able to start placing bets until this summer. The The Missouri Gaming Commission first needs to create regulations, which require approval by the governor and the Secretary of State. After a public input period, the state can begin issuing gambling licenses to casinos, online platforms, and professional sports teams. Gaming Commission Chair Jan Zimmerman admits to hearing frustration from residents about the delay.
We try to, assure people that we're working hard to make sure that we're not only protecting the industry, but we're protecting the people who will be engaged in sports betting to make sure that they're protected as well.
With the Kansas City Chiefs heading into the playoffs, Missouri residents who want to put money on the team will have to head to a neighboring state like Kansas or Illinois, where sports betting is already legal. Concussions are on the rise for female athletes. Research shows that concussions for these athletes have tripled in the last 2 decades. But Dr. Jamil Neme, the director of the Concussion Clinic at SSM Health St. Louis University Hospital, says there's very little science to explain why. St. Louis Public Radio's Marissanne Lewis-Thompson spoke with Neme about the gender disparities in concussion research and what he thinks has led to this trend.
In general, we certainly have more or better reporting of head injuries in sport. And so we have a lot more awareness. So these things kind of get diagnosed appropriately. And then historically, research was done on male athletes. And so as more and more research continues to come out, we start to see like a little bit more inclusion of different demographics. And then we get to kind of see maybe what differences there are. And then also the increase in female involvement in sports as well. With more girls playing sports, we're going to have more incidents of head injuries.
The conversation surrounding traumatic brain injuries typically center male athletes, particularly in football. Why has research into female athletes who've experienced concussions taken a back seat a bit?
It just has taken a little bit of time to get good quality studies looking into what the differences are and what that might mean for females versus males. So like historically where those research articles were done primarily on males, now we're just kind of having more and more on female athletes.
When you're thinking about this particular dynamic, it is surprising that the conversations are not being had in terms of like young girls. I've seen plenty of conversations when it comes to like boys getting into like football or how to keep them safe. But are you surprised by that at all?
I am surprised that I'm not. So yeah, I guess that would be like a gender bias of we know that the boy's going to get into rough things and want to play contact sports. So we're going to want to make sure we give them the right information. And we just, I guess, don't expect that from our girls. But that's certainly changed a lot. And with the rise of female athletes and people getting excited about it, there's going to be a lot more opportunities. And I think it is reassuring that another reason for those increase in numbers is also increased awareness. The girls maybe are more upfront with their symptoms and coming to their parents or coaches or doctors and saying that they might have had a head injury and want to get checked out. Whereas there might be some bias against being forthright with that information with some of the boys.
Why are female athletes more susceptible to concussions?
Intrinsic factors, like if females have a smaller neck size or strength, then they may set them up for higher incidence of concussion. There may be other things at play, including playing surfaces, and one other factor might be direct access to care.
Historically, women's medical concerns are not taken seriously. How does that reality affect their recovery outcomes when they do have a concussion or another form of a brain injury?
That is a difficult one, especially in something like concussion where a lot of these symptoms are subjective. And so it's important for the medical provider to take in all the things and all the symptoms that their patient, regardless of what demographic they are, listen to all these symptoms going on and seeing where the management needs to go next. And so it certainly means that we have to be better at our active listening and seeing how we can help our patients.
There is currently a lack of research into gender disparities in concussions. What are some key areas that you think need a closer examination?
I think we get into more of the, are there more intrinsic reasons why? So I alluded to the neck muscle strength and size. Maybe there are hormonal differences, or maybe there's age discrepancies. Maybe there is something different with time to recovery. There's certainly a lot of room to figure out if there are differences and what we can do about them.
That was Dr. Jamil Neme, the director of the Concussion Clinic at SSM Health St. Louis University Hospital, speaking with St. Louis Public Radio's Marissanne Lewis-Thompson. Our Jonathan All edited that conversation. The Gateway is a production of St. Louis Public Radio, a listener-supported service of the University of Missouri St. Louis. Theme music by Ryan McNeely of Adult Fur. I'm Abby Larico, and from the St. Louis Public Radio newsroom, this has been The Gateway.